Chaitanya. Today, I'll show you how to use our Vaidya Kit software. Basically, what you have to do is you just go to your Gmail. So here is my Gmail, and here you would have got the email from Base 44 app. So you can see here invitation to join Vaidya Kit app. Okay, so Vaidya Kit is the name of the app, and so if you go down, so here it will give join Vaidya Kit now. Okay, so you just click there. So it is opening. Well, it is asking to log in. So you just continue with Google. So I'll click here. So that's it. So after your successful subscription, so you will be able to access the app. So this is how the software looks. Basically, first you will be greeted with the dashboard. Here you have total patient, available medicine, consultation revenue, total profit. So down, if you see here, recent patients will be shown here, and here you will see the medicines. So now what we'll do is directly we'll just go to the dispensary. You look at the left side, so go to dispensary because we have to add some medicines here because you will be giving medicines to your patient. So here you can see right side top. So just click add medicine. So here we'll add some name. Maybe we'll add Yogaraja Gugulu. Okay. So you can enter the manufacturer name. I'll write it's SDM and quantity. So quantity, stock quantity is how much quantity you have, how much bottle of Yogaraja Gugulu you have. I'll write it as 32. Let us take. So unit size you can select. Inside each box, how much tablets are there? Like now I'll write 60. Okay. And here also if you have, you can write custom options. Other if you write, so here you can write if you have only 10 tablets, you can write that also. Okay. So right now standard is around 60 or 40 or 100 will be there. So I will 60. Expiry date you can write here. I'll write next month as the expiry date. So just to show you, here date is also there. Usually date will not be given, only it is month and year, but still you can write the date also. So I'll write, okay, 12/12/2025. So amount, the cost price is how much you got. What is the cost for you as a doctor, not for the patient? So maybe for one bottle, it will cost 150 rupees. Imagine. Okay, sometimes it does do like this. So you just make it 150. And then MRP is how much cost for the patient. Maybe we'll write it as 250, right? So you can also write the benefits of the medicine. It's left to you. Then click add medicine. So yes, you can see here the medicine is added 32 units of 60 numbers means 32 box are there. Inside that 60 tablets are there. Cost, MRP, profit. So you are getting 100 rupees profit from each bottle. Okay, so that's how it is there. Towards your right side, you can see expiring soon column is there. It's showing one medicine. So basically this one, it is also showing an indicator here. Means it is telling you that this medicine is going to expire. Okay. So how it works is within 1 month, if any medicine is going to expire, it will show you. That's how. Now let us come to towards your left. We'll go to new patient. So here you can write the patient details. Maybe we'll write name as Guru. Okay. Age will write 50. Date of birth you can add or you can leave it. So male. And again, all these things are there which you can fill it. Mobile number, emergency contact, marital status, occupation. Okay, we'll write it as married. Okay. Consultation fees. How much consultation you have charged them. Okay. So I'll write it as 100. Okay. Address also you can write. So then go to next step. So here you have the chief complaints, associated complaints. Okay, I'll write bilateral. knee joint pain. So just to show you, associated you can write. Then go to next step. Then you have medical history, history of present illness, past illness, medication history, family history. Okay, you can fill it. Then you also have personal history like diet. A lot of things are there. I like non-vegetarian. So like this meal pattern, Agni. So sleep, smoking, alcohol, all these things are there, which you can write it. Menstrual history is also there for females. If it is there, you can write this also. And then we have the Ayurvedic assessment. So we have Dashavida Pariksha and Ashtasthana Pariksha, Trivida Pariksha. So all these things are there. Then you also have, yeah, clinical examination, temperature, respiratory rate, all these things are there. So general examination, I'll just write SLR negative, just like that. Okay, simply to show you. Or systemic examination is also there, which you can just fill it. And then you have the investigation, if you have done, so that also you can write. Provisional diagnosis, differential diagnosis, final Ayurveda diagnosis. Because some people like provisional diagnosis, some people want modern, and some people may want Ayurveda also. So both options are there. Let us write rheumatoid arthritis. Okay, just simply like that. Here we'll write armor. Okay. So treatment plan, how you are going to plan the treatment, panchakarma, lifestyle, all these things are there. Now coming to medicines. So we have added Yogaraja Gugulu. So when I type Y, it is showing Yogaraja Gugulu. See, so it is showing stock left is 32. Maybe I'll add two box for them. Just click the tick and you can see this green means it is confirmed. Okay. So then you can save the patient. So it takes just a moment. Yes. So the patient is saved. Now you can see a recent patient, Guru, 100 rupees consultation. From medicines, you got 200 rupees profit because 100 rupees profit for one box. Two box we have sold means then 200 rupees profit. Total profit is 300. Okay, so that's how it shows. Now, suppose you want to look at this patient now. Means you go to old patient towards your left. So here you can see it auto generated the patient ID P0001. So if you click here, you will get the basic information of the patient along with chief complaints, general examination, and prescribed medicines. So all these things it will show. Now, if the patient came to follow up, then you can also give here new consultation. You just go down, new consultation fees. Maybe again I'll take 100 rupees. Okay. So fresh complaint, I'll write running nose now. Running nose into 20 days. Okay. Again, what medicines you have given? Again, I'll write Yogaraja Gugulu. See, now stock it is showing 30 because already we have given 2. It was initially 32. Now it's showing 30. Now suppose I give 10, 10 bottles of Yogaraja Gugulu. Okay. So confirm, save consultation. Okay. So yeah, this how it is. So here it is the initial thing. If you just go down, consultation history will be shown. So on that date, this is the follow-up. So all these things it will show. Then if you go to uh, dispensary, now you go to dispensary. See now here 20 units it is showing. Why? Because already 12 bottles we have sold now. We have given to the patient. So only 20 is remaining. So it will update automatically as you give the medicines to the patient. So that's also there. And here you can see inventory value, potential profit. So that also it will show based on all medicines. Now towards your left, let's go to reports. So here you can see on a given day or given date range, how many patient came to you. Suppose I'll give today's date because I have added today. So if you give today's date and if you click generate report, you can see here. Fine. So it will show initial visit and follow up. Both it will show here, right? So in the follow up, of course, diagnosis is not there. So it is only the symptoms is there. So that's how it works. And then you can also top, if you see, detailed patient report option is there. If you go here, you can select a patient. I have added only one patient, Guru. So here you will get all the details which I have filled. Okay, only what you have filled, it will show. If you have not filled something, then it will not show. Okay. So this patient report directly you can print it. So if you click the print button, so here it will give. So if you have a laptop or have your printer with you, then directly you can print, or you just go here and save as PDF. If you give, it will also save as PDF. So both options are there. So you can print the thing directly. This is how it works. And now if you see one more, invoice tab is there. Here you can also, yeah, you can select the patient, invoice type. So I'll give all consultation means from the starting. See, initial consultation, medicines, follow up, and follow up medicines. Everything will be shown here. So like this also you can either download or you can print. Okay. See, download means it will save in CSV format, which is not much suitable for you. So printing is more better. You can print and save as PDF. Suppose if I don't show all consultation, I'll give single visit. So then here you can also select the visit date. I'll just give the follow-up one. See here, only follow-up will show here. Okay. Okay, so all these options are there. Now let's go to the left profit page. So in the profit, so again here you will have the monthly analysis, yearly analysis. So in the top you will get the total profit. Okay, from the time of installing this app. So here you can see the month wise. November it is showing how much it is there. And if you are concerned about your data, just go to the settings. Then here you can delete all your data so that if you are not subscribing anymore, you can delete your patient's data. So before deleting, you can obviously export all this data by generating the PDF and you can just save it. So that option is also there. So this is how the app works. If you have any doubt, you can further ask me. And we have also made one more app, one more software which is uh, more towards classical Ayurveda. So here we have chief complaint. So directly you can go here, medical history and all. So instead of that, we have another app having which works similar to this app. But instead of all these different criteria, we just have Roga Pariksha, Rogi Pariksha. We have Darshana, Sparshana, Prashna, and Roga Nidana Purva Rupa, Rupa, Lakshana, Upashya, Samprapti. So in that way also it is there. The app name is Siddhi. So I'll show you that app also. So whichever you find is useful, you can use the app. Okay. So thank you. If you have any doubt, you can please ask me.